Okay, good morning, everybody. How's everybody doing today? Fabulous. Good. All right. So my name is John Owens, and I work for Flips, Finger Lakes Performing Provider Systems, and we are here today to present on the Career Pathways training program that we have available at Flips. Um, So I am going to get started. First of all, what I'd like to do is we're going to put in the chat the website, and I will have Kathy or Alaka put that in the chat, the healthcareersnow.org/CPT. That is our website where you guys can go to fill out an interest form after the presentation, if any of you are interested. Okay, next slide. And we are going to take questions throughout the presentation. We're not going to wait until the end. So feel free to put your questions in the chat. You can raise your hand. It's probably best to put your questions in the chat or just say that you have a question in the chat. And then someone on my team will let me know and we will take the questions as we go. Just so we don't talk about something and then get a question about it much later on. So. All right. So, like I said, we are the Finger Lakes Performance Provider System. These are our strategic pillars at Flips. Today, we're going to be focusing on the workforce pillar. And the reason for the CPT grant that we received is to strengthen the healthcare workforce in New York State. And that's what this program, in the long run, is going to do. So, Flips and the workforce. So, as a designated workforce investment organization, it's called a WEO, and that's one of the acronyms we use. So, we're one of three WEOs. We are focused on strengthening the healthcare workforce through programs and services that diversify the healthcare workforce pipeline and provide opportunities to those who may not otherwise have them, while also supporting the community's economic mobility. So, we are trying to increase the workforce in these key areas that are on this slide, amongst others, where we've had shortages in New York State. So that is the purpose of Flips getting this funding and us being able to help pay for what we're going to be paying for. With two Next slide, please. Okay, so this is the New York State Health Equity sorry, 1115 waiver. And again, what we're going to be concentrating today on is the Career Pathways Training Program, which is our program. On the left there, you see some information on social care networks, population health, and strengthening the workforce. Um, Flips does all of these things, but today we're going to be focusing on strengthening the workforce in New York State in those key areas, and that's what the CPT program is all about. Here is the budget. So this is the waiver, that 1115 waiver that New York State had. It's $6.9 billion. Our CPT, Career Pathways Training Program, received $645 million of that 6.9 billion. As you see, the rest of the funding in this chart shows your graph, shows you where all the rest of the money went. But the 645 million went to three different WEOs, as I talked about earlier, in the state. That's basically just three different areas in the state. Got that $645 million split up between the three areas. And that is the funding that we received in order to help participants and students go to college, pay for things. And then I will talk about later on down the line what the responsibility of the students is after they graduate. So this just talks about the federal impact on the waiver. Basically, the federal government published a federal position on waiver financing. saying that they would no longer approve the DSHP funding. However, New York State Department of Health has confirmed that the federal government will continue to honor the terms um, of this grant and this funding. So we're not going to lose this funding. And the funding goes through the end of March of 27. Our students that end up applying and for this grant have until the end of May of 2027 to graduate from whichever program, whichever educational program that they are enrolled in. So that's just one of the things to keep in mind down the line. And the New York State Department of Health made it clear that this letter that's talked about in the first bullet doesn't impact our funding for this waiver, which is really good news. So here are the three different WIOs in the state. Um, Region 1, as you can imagine, is the biggest region. Um, Region 2 is Capital Region, the Southern Tier, Central New York. And then region 3 is our region. Those are the 18 counties that we contract with, um, and where we have contracts with schools with. And if a student lives in a different area and is going to be attending school, let's say in New York City, and they reach out to us in our quote unquote WIO, we refer them to the correct WIO and to the correct county and to the correct workforce investment organization to get them started and to get them, help with the CPT program. But we do collaborate very closely with each of the regions. So all three regions, we meet regularly, collaborate, do most of the things the same way, learn from each other. So it's been working out great. All right, so now we start to talk about the fun stuff. So this is the Career Pathways Training Program, the CPT program. It addresses statewide workforce shortages, kind of like I mentioned earlier. It provides tuition, educational expenses, and support services. Um, and it's organized by two career path lines. So career advancement or new careers. Career advancement for someone who already is in the workforce and wants to move on to a different career, or new careers, someone who's not in the workforce yet, who's looking to get a job and to enter the workforce. So the program targets high demand shortage areas, reduces barriers to career advancement, and supports marginalized and underrepresented communities to enter and to advance in the health and behavioral health of social care workforce. So here's the nitty and gritty of the program. So our participants will make a 3-year full-time work commitment in the new professional title after they graduate or after they get their licensure. And so they have to work for 3 years in New York State, and it has to be an organization that supports at least 30% Medicaid receiving individuals or 30% uninsured individuals. So, if any of you were to get into the CPT program, go to school, get your degree, and you currently work someplace that you'd like to be affiliated with us, you actually can help connect them with us. They have to be, they will get an attestation from us. They will sign it. They will prove that they do serve 30% Medicaid, 30% uninsured. And once they do, then they can be kind of quote unquote on board with us and one of our eligible employers. So, but that has to take place. So, the organization or the employer has to be affiliated with us, but it is a process that we can make happen as long as all of those things are met. So, those are the titles down below that we pay for schooling so what we pay for is we pay for tuition, we pay for books, and we pay for scrubs. So those are the things we pay for. Later on during the presentation, you'll see different things that we don't cover, but those are the things that we cover. Here are the titles that we have. Now keep in mind, if the title or the program that you want to get into doesn't finish by May of 2027, by the end of May of 2027, then it's not going to be eligible. The program has to finish by then. So if you'll notice, there are stars next to two of the programs that we have down here, nurse practitioner or NP and physician assistant, PA. Those two, we are no longer accepting applications for those titles because they don't finish in time.
I
Okay.
have a question.
All right.
I'm looking at the Masters for Licensed Mental Health Counselor.
Okay.
Um, and now how feasible would that be to end on end at that right time? Because they're 60 credits long and I'm just not sure if I can do it.
Yeah. So what happens is with each college or institution that we are in contract with, we get cost and liability with them, and they let us know which programs they have that are our 13 programs, or really 11 now, that finish on time. So that finish by May of 2027. If any of my coworkers that are on the call right now know of any licensed mental health programs
I know
that
one.
we have with school, go ahead.
Yeah, Aaron, I'm in communication with SUNY Fredonia, and they have a special program that they designed specifically for students with CPT. So you want to check them out because the program begins August 25th, so you'd want to reach out right away.
And
Okay.
yes, Caroline is right. You definitely want to reach out right away because we at Flips have a 14-day deadline to have your application filled out with us before the start of the program. Um, which in your situation here might be tough because you have to get accepted by the program as well, and then you have to provide us with the acceptance letter. But certainly, could research the schools that we have on our website uh, and see which of those have programs and how long the program is. Um, and then you can also reach out individually. I'm going to give you all my email, and you can reach out to me individually, and I can absolutely find out for you
Okay.
um,
Thank you so much.
on an individual basis. Oh, you're very welcome, Aaron.
I have a question as well. I'm
Okay.
already through the whole process of applying and getting accepted and at the book and the payment section. Like, I've
Okay.
gotten get my books. I just, because I'm still being asked to pay the
Okay.
book. So I was wondering about that process.
Yeah, no, that's a great question. So that's a very common question. We get asked it daily, so it's a very good question. So what Flips does is we don't make a payment to the school until there's 100% liability met with the class. For example, if I start class on 8/25, Flips isn't going to pay my bill until I get to the point in the semester where I'm 100% liable to pay the school, if you know what I mean. So, in other words, if I were to drop after about a week, this isn't for me, I can't do this. Flips hasn't paid yet, which means I would not owe money back at the end of the program, if you know what I mean. So what Flips does is we wait the until the student is 100% liable to pay the school, and then we make the payment. So once that date comes, it's usually 6 to 8 weeks after the semester starts. And then once we get the invoice, we have another 60 days to pay it. So it can take up to 2.5 to 3 months for there to be a payment made on your behalf. What I would say is if we accepted you into the program and you are a CPT participant and you get a bill, do not pay it because we cannot reimburse students or participants. We can only pay the schools. So that's very important to remember.
What about books then?
Books, you will work with your case manager at Flips. So at my organization, our organization, you will have, if you've already applied, you have a case manager with us. and they will help you through that process. They will help you figure out what book, how to get the books through the bookstore. What happens is we have contracts with all of the bookstores.
Okay.
Not all of the bookstores. We have not contracts, processes. You know, because some bookstores are on campus, some are outside providers. So it's kind of a case by case basis. Um, but your case manager with Flips will help you with all of that. And again, I'm going to put my email in the chat, and any of you can reach out to me with any questions,
Okay.
especially if you're in the program and aren't
Yeah,
getting the
I did
assistance that you need.
my thing of like a long while ago, like it was like last month or a month and a half ago, because someone said submit your application. I've already done all that. I don't know who my case manager is, but yeah,
Okay,
I guess I'm at a standstill because I don't know.
that's
But
okay, Cherish.
I got a letter saying I was accepted, so.
Okay. Yeah, if you got a letter saying that you're accepted, what happens is you would have connected with your case manager early on in the pre-services part uh, before you would have even gotten the application. And it was probably just so long ago that, uh, but it'll be that same case manager. But just reach out to me and I will be able to help you. Um, and I'm
Hello,
putting,
I have a question.
thank you, Alanka. Yes, go ahead.
Yes, my name's Ian Bean. I work in
Hi,
Arne
Andy.
Ogden Medical Center. Yes, I got accepted in Damon University's nurse practitioner program, but it was 2024 September. So I'll be graduating in 2026 December. Does this CPT still apply to me or no? Because I've already been in the program for 1 year.
It doesn't. I'm sorry. That's a great question.
Uh,
You have to be a new student. And if you've already started the program, you're not eligible for the CPT
Started
funding.
1 year
But
ago.
that's a
Thank you
great
very
question.
much for the
Yeah,
information.
that's a good question. Oh, you're
Hi,
very
can I ask a
welcome.
quick question?
Sure. Lucretia?
Yes, that's me.
Right. All
So
right.
I already have a degree in communications, but I'm changing career paths and interested in becoming a nursing student. Would this program, would I be eligible for this program?
Absolutely. Yeah, it's a new program. As long as it's a new program that you haven't started somewhere else, before,
Hmm.
uh, you can go to our website. It's healthcareersnow.org/CPT. I think it's in the chat in the very beginning. Alanka or Kathy put it in there. And you can fill out I think it's a green button on the main page. It's called the interest form. And you want to
Hmm.
fill that out and get started. But
Okay, cool.
and I think Alanka just put my email in the chat. Anyone can reach out to me as well, and I will help you guys.
All right, thank you.
You're welcome. Mary, go ahead.
Hi, I filled out the interest form on the website for Fredonia for you guys, and I have not gotten an email back. And I know they said it could take some time, but I'm worried about the approaching deadline and wondering when
Did you
when
fill
those
out did
emails
you
come
fill
out.
out the interest form? Did you fill out the interest form on our website, healthcareersnow.org/CPT? That's where you have to fill it out, not at Fredonia. So,
I think it must forward to it, but because that
okay.
was what they said, is that it. So is there a window of from when you get the interest form
No.
to when you send out the email?
No, it would be sent immediately. So if you didn't get
Okay,
it,
so maybe I
reach
have
out to
to.
me. Yeah, just reach out
Okay.
to me.
Okay, thanks.
You're welcome.
I have a question. I'm wondering
Okay.
about, do you have to apply for the TAP and the grants with the higher?
You do.
Okay, and is there a
Great
link for
question.
that? Because
Yep.
I was trying to
So,
do that
and just so
yesterday.
you guys know, yeah, just so you guys know, some of this stuff maybe I'll cover later in the presentation. If you want to wait with the questions, I'm happy to take them now. But some of it I might cover. To be able to apply for our program, you have to give us proof that you've applied for both TAP and FAFSA if they are applicable, because our money, Flips's money, is the last money in. So if you are getting TAP or FAFSA money, that will be used first, and then we will pay the remainder if you're accepted and approved by us.
But if you're not getting any money, but you've
That's
applied.
okay. That's okay. Yeah, that's okay. Good question.
I have a quick question about that. I'm sorry. I know you want to get
No, you're
moving
good,
along.
Sandy. It's all good.
So I applied for TAP and FAFSA, but I emailed my coach, but I never got word back. What would be the negative effect if one is to accept Pell Grants or unsubsidized or subsidized loans? Does that take any impact on the assistance that we will receive on with the CPT program?
So I know FAFSA and TAP money will be used first. I'm not sure on the Pell Grant. I don't know if either of my coworkers that are on the call can answer that. And if not, you can email me and I will absolutely answer that question.
John, I can
Perfect.
take that. It is the last
Casey?
dollar. So any scholarships, any grants that you receive will be applied and then the CPT will be applied, but it doesn't, receiving any of that does not negate you from receiving the CPT funds.
Okay, I think I will
Thank you, Casey.
inquire through email about any additional questions. I appreciate
Yeah.
your time.
Oh, absolutely. And then the thing to think about that with that is, Cindy, if you're getting grants or other tuition assistance that, let's say, pays for the majority of the schooling, you may not want to use our funding because of the 3-year work requirement. Do you know what I mean? So you would have to kind of weigh that, you know? So,
I see.
but yeah, but it's just things to think about. So
I have a
Okay, thank
question.
you.
Sorry.
you're good, Caitlin.
So I've applied to JCC. I've set up my schedule for it's to go into nursing, but for right now, it's technically their individual studies. I don't think they have me completing it until 28, but I won't be technically in the nursing program until next fall. Is it too early for me to apply to this now since I haven't technically been accepted to their nursing program?
It's
Or
not too early to apply with us, but to fill out a participant and interest form, but
okay,
but you won't be able to fill out the application until you have the acceptance letter from the school. And if you don't finish by May of 2027, then we also will not accept it. So,
okay.
so if you're finishing in 2028, then that would not be something that we would be able to help.
So is it just for like if you've already been accepted into the nursing program? I guess is my
Sorry. So what's your question again, Caitlin? Is what if you've been
is
accepted?
is CPT for like if you've been accepted to the nursing program or if you're working towards being accepted?
CBT does not pay for any prerequisites or anything that you have to
Okay.
do before. Once you're
Okay.
accepted and you have that acceptance letter, you can fill out an application with us and then we can either approve or deny it.
Okay, so I guess JCC, you have to like, I'd have to apply for the nursing program at the end of middle spring to get into the program in next fall. So do you guys, this happens every year, right?
Yeah, but I don't know if you will finish in time if you start next fall. You have to finish by May of
Okay.
27. So you just
Okay.
have to check to see if the program finishes by then.
Okay.
And our case managers will help you, Caitlin. So if you fill out an interest form and you get into the pre-services part of our system, you'll get assigned a case manager and they'll be able to help you with all this stuff.
Okay, thank you.
You're very welcome.
Hi, my name's Jackie. I have a question too. So I have been busy. I filled out the interest form with all of you and I know I got something back, but in the meantime, I'm also applying to Fredonia for that program that someone else spoke about, the clinical mental health, which they are still accepting applicants and they've been really helpful with this. But I'm looking in my email track. What is your heading that you send? Because I know that I sent the interest form and then you kind of gave me an update, but I can't seem to be able to track it. Do you know, when you send out emails, who is,
Alaka, can you let her know what email address she would be getting responses from? And if not, Jackie, you can just email me directly and I will help you.
okay. And your email is somewhere?
Yep, it's in the chat.
Okay, great. Thank you.
You're
Jackie,
welcome.
if you can please post in the chat your name, email address, and your question, and we will be replying later.
Okay, beautiful. Thank you.
You're welcome.
All right, Patricia.
Hi. Um, I'm um I'm accepted and hopefully starting a KSAC training program at Niagara Community College, but it's not listed on the CPT website. But I know it gets WIO funding from Niagara County, but I live in Erie County. I've had a big problem trying to get this grant so far.
Okay, just shoot me an email and
Okay.
and I will do what I can to try to help you.
Okay, thank you so much.
You're very welcome. All right, I'm going to move on. Next slide. Any other questions? Feel free to ask as well.
I have a question.
Sure.
I'm in the Buffalo, New York area. I wanted to know, is there like a website or do you have anything on the website that has the Medicaid providers that you guys
Yep. No, that's a
currently
great
work with?
question. No, it's a great question. So we are in the process of putting together a list of all of our eligible employers. Um, if you have one in particular, specifically, you know what I mean, that you wanted to email and ask about, we might be able to give info on that. But we do not have the list compiled yet, but we are in the
Okay.
process of doing that. And maybe if Casey wants to talk about that for a second, she can. And if not, that's okay too.
Yeah, I can chime in. We are in the process. We will have that available very shortly. We are expecting to cover the whole entire area. So we have I know Kalida is generally pretty big in that area, and we are in the process of getting that agreement signed. Most of the facilities that you are aware of, we will have contracts for, and we expect probably within the next couple weeks to have our website up and running so you can see all of the different opportunities of where you can work when you graduate.
Okay, thank you so much.
You got it. All right, so here are some of the program details. Patricia, do you still have a question, or is that just your hand raised from before? All right, you're good. Okay, so here are some of the program details. Those are the two career pipelines I was talking about earlier. The first is for career advancement for individuals currently working in health, behavioral health, or social care that want to advance to a different career. And then the new careers for individuals who are unemployed or not currently working for a New York State health provider. So here is some of the important details, which we've talked about some of this before. Funding is only available for new students. Funding is scheduled to expire on, this says March 31st, 2027. So that's the funding. But we can make payments by that date for someone who's graduating by the end of May of 27. So that's the date that you all want to be cognizant of, is the end of May of 2027 is when your program has to finish by. And it says it. Any incoming students must be on track to graduate by May or June of 27. It's actually the end of May of 27. Participants are then required to complete a 3-year full-time service commitment at a New York State Medicaid enrolled provider, like we talked about earlier, that serves at least 30% Medicaid and uninsured individuals. And the thing to remember to know is that this service commitment must be completed by 2031. So basically, you have 4 years after you graduate to work 3 years. And I do see a question in the chat. The work does have to be in New York State. So it has to be in New York State at one of the employers that we have an agreement with, an attestation with. These are the things that the CPT program participants will receive: application enrollment assistance, tuition coverage. Like Casey mentioned earlier, we are the last money in. You'll also get education case management. So I'm the support services manager at Flips, and we have a team of 8 case managers who are incredible, who will help you through all the steps from the very beginning to the very end of this. You'll also receive tutoring services. We contract with 2 different tutoring organizations that help with tutoring, along with the schools themselves, where you can also get tutoring. We have opportunities for apprenticeship and mentorship, and we will also help with employment placement assistance. Um, and then for employers, there's a backfill program that we have. And if any of you end up having any questions about that, you can also email me and I can get you information about it for your employers. And basically what it does is it prevents reduced access to care. So for example, if one of you has to work a little bit less now, a few hours less a week because you're going to school, this program covers up to 2 days per week of backfill. But it requires the employer to have an agreement with us about the pay and about how that's going to work out. But you can email me on that if you have any questions on that.
Okay.
Next slide. Thank you. Okay, so here are the requirements. To be eligible to be a program participant, a CPT participant, you have to be a U.S. citizen or an eligible non-citizen, which is explained at the bottom. You must meet all the educational training program requirements based on the selected CPT title and course of study. So prerequisites, a licensure that you might need before you start the program or a certification, any entrance exams, any required training or volunteering that's expected before you start the program. You also must be a New York State resident, okay, in order to be eligible for the CPT program, or you must live in one of those 5 bordering states, but you have to be currently working by a New York State provider when you apply in New York State. So that's how someone from those 5 states can be eligible to apply for the CPT program, is if they are employed by a New York State provider in one of those 5 states. And then you have to be committed to a 3-year full-time employment. New York State Medicaid enrolled provider, and we've talked about this before, serves at least 30% Medicaid or uninsured individuals. Next slide. Thank you. So here are the support services that I briefly mentioned earlier. We have case management at Flips that will help. We have pre-training and academic program readiness. So basically, our case managers can help you figure out maybe what career path you might want down the line. So then what schooling you might want to get into. We have academic and training program support. We have advanced academic support, job readiness, placement, and support. So that's basically after you've been in school and when you're about to graduate, we will help with getting you ready for jobs, job placement, and then support. And then we also have access, and our case managers have access to help with language services and other supports. Next slide, please. Okay, so this is what our funding on the left can cover, which I've already gone through. The academic supplies is under number 5 there. So we pay for textbooks, scrubs, and lab equipment. So the lab equipment we only pay for if you can purchase it at the bookstore or at the place where you get your scrubs. So as long as it's a place that we can pay, like that we have a system set up to be able to pay for those things, we will then pay for them. Costs not covered by the CPT program are over here on the right. So room and board, living expenses, meals, parking, transportation. We do not pay for laptops. The only exception to that is if the institution only uses laptops for their learning and for their books, and that basically is their bookstore, is the laptop that you do all of your learning off of, then we cover it because it's basically textbooks. We don't cover background checks or vaccines, N95 fit testing. We don't do CPR certification, drug testing, or any other standalone processes that are not part of tuition, but that may be required for programs and clinical placements. Next slide, please. Okay, so this is what Casey was talking about earlier. We are utilizing JobSpeaker as a platform to collect vacancy data from all attested providers. So in other words, if we are going to accept 60 nurse practitioners from a school in Buffalo, we want to make sure that there are going to be at least 60 nurse practitioner openings or jobs in that area for you guys, for the participants to be able to apply for and get those jobs. We don't want to set students up to fail, in other words. We want to make sure that if we're accepting and paying for tuition, that there are going to be jobs available in the areas. And we have team members that are doing this and that have done this and are doing a great job making sure that we're not setting people up to get a degree where then we can't help them find a job. So, next slide, please. And Connie, I will get to your questions soon, I promise. Okay, so this is the journey from start to finish, 1 through 14. So number 2 is where you submit the interest form I talked about earlier. And then 3 and 4 is where you're going to be, it's in called pre-services in our system. It's a GoCo system. It's where you'll meet your case manager. It's where you'll talk about what program you might be interested. It's where you'll go over your acceptance letter with the case manager to make sure it's acceptable by us. And then you'll be able to, number 5, apply for our program. And when you apply, you'll sign a participant agreement, which is that agreement that I talked about earlier, where you're going to agree to work in New York State for 3 years after you graduate. Payments made by Flips, talked about a little earlier about when that happens and why it happens when. And then a little bit about the case management. You're going to be working with your educational case manager throughout the entire process. And then when we get down to the service commitment, down to 11, we're going to help the individuals get placed in a job that is in the same field of study that they just graduated in. And then and then eventually you will complete your service commitment with New York State. Next slide, please. All right. So as of July 7th, we have reached over 1,000 enrolled students, which is pretty awesome, pursuing those 12 job titles. And we are still going on and on and on every day. Both, getting applications sent out, approving applications, and it's just it's something, we've been kind of at Flips been kind of creating and building this as we go, and getting better and better at what we do to be able to help all of you be as successful as you can. So we're pretty excited to have over 1,000 students enrolled already from 19 different counties. And then here are our participating schools. This is as of June 9th. I could tell you all that we have more schools than this that are on board with us right now. And when you go to our website, which is that first link that I provided, you'll see the schools, you'll see the program titles, you'll see a bunch of the information that you would need. And I believe that might be the last slide. There's probably one more. Look at that. Questions and thank you. Okay, so Akani, is that how I say your name?
Yes.
Okay.
Can you hear me?
Yes, I can.
I appreciate you taking the time to do this information session as
Very
well as taking
welcome.
my questions. So my question is about the 3-year work commitment at the 30% either Medicaid and or uninsured facilities.
Okay.
Do you have an idea about how that would work if in the future the federal government cuts Medicaid or there are very little or no healthcare facilities in New York State that are servicing at least 30%
Yeah.
Medicaid or uninsured?
Yeah, great question. So if that were to happen, the state would have to um, take that into consideration, and then things may change with the requirement if that were to happen. And that's just me thinking to myself out loud. I don't know if Casey or Kathy that are on the call have any other opinions, but that's what I think would happen. If something like that were to happen, then it may not be feasible for the organizations to serve 30%. Now, that may increase the number of uninsured, Akani, so then it may end up being, you know what I mean? They may still end up qualifying to be a 30% employer, if you know what I mean. But
Yeah,
yes,
I was just thinking in
that's
terms
what I
of
believe.
I was just thinking in terms of like if around me, it's really easy currently. I live in Rochester, New York, to
Yep,
find
me too.
an employer to service 30%, and then in the future, let's
Yes,
say
it
by the
is.
time I graduate, the closest one is in New York City or something like that.
Yeah, no, yeah. The state would take that
Akani,
into
oh,
consideration.
sorry.
Oh, you're
Akani,
good.
that's a great question. And we definitely would work individually with each person to make sure that you're successful. So, that's something that your case manager and our team at CPT would make sure that we would help you to find those, in addition to what John was saying.
That's perfect. I mean, I prefer to work at a facility like that in general. So that is a huge help. Thank you so much.
Oh, you're very welcome. And that's actually part of why this program is so great, because it's not only helping participants and students get an education and get into the workforce, but it's also guaranteeing that we're helping, the most underserved by placing our students in organizations that serve the underserved and the uninsured. So that's just why, it's just one of the many reasons this program is so awesome. Mary.
Work requirement. Do you start working like while you're still in the program, or does that start after you graduate?
It starts after you graduate. After you have the degree, you then have to work in that field for 3 years. Good question, though. Sheena, is that how I say your name?
Yes, that's correct.
Okay.
Thank you.
You're welcome.
My question is, how do you go about filling out the TAP? Because I haven't given the letter yet to my caseworker that I got accepted into the program, the mental health
Okay.
counseling program.
Yep.
So
Your case manager will help you fill out the TAP and the FAFSA. So once you fill out did you already fill out a participant intake form with us? And
yes,
did you
I
already-
did that, but I've just been emailing the case manager. Are we
Okay.
able to talk to them, or is it just an email?
Absolutely, yes,
Okay.
Sheena. And if you're not able to do that, email me and then I'll give you a call and I will get your case manager in touch with you.
Okay, and the last part then, so St. John Fisher University, I have to send my acceptance letter to my case manager, or are they in connection with the college?
You have to get the acceptance letter from the college saying that you've been accepted for the program, for the time frame, and then you upload that into your application with us.
Oh, got it. Okay, thank you.
You're very welcome.
Good
Any
morning.
other questions?
Good morning.
Good morning.
I'm in Onondaga County in Syracuse, and
Okay.
I was forwarded the Flips interaction for today.
Okay.
And there is no way to contact the individuals in Onondaga or in Syracuse, the parallel program, one of the three programs you have.
Yeah.
Is there any information to be able to contact them? I mean,
Absolutely. Yeah. Alanka or Kathy, could you put that in the chat? And if you don't have that information like handy, Micah, is that how you say your name?
Yes, Micah.
You can email me, Micah, if that information isn't put in the chat, and I will get you connected with them.
Okay, because I'm in the last stages with Fredona and acceptance, and I heard you say 14 days prior to.
Yeah, absolutely.
Yeah.
Yep.
So,
Did you say Fredonia, Micah?
Fredonia. Maybe I might not be
Fredonia's a
saying it
great
right.
school, let me tell you. No, you're saying it right.
My
It's a
southern
great
accent.
school.
Right?
That's where someone
All
I
right.
went. That's where someone I know went. So that would be
Okay.
me. That would be me. It was a great school.
All right. Thank
All
you.
right. Oh, you got it. Jackie or Jacqueline?
Yeah, hi, John. I have another question for you. Maybe being a little overly ambitious, but I'm actually applying to the Fredonia Mental Health Counselor Program, which I'm really excited about. Just curious, just because there's overlap with some of the credential alcohol and substance abuse counselor programs, and that's more of like a certification online program. Would it be possible if I want to do both things at the same time to do that? So my primary thing is Fredonia, but I'm just looking at it and, and like I said, I may be overly ambitious, but I'm looking at this certification and, which would help me, but I guess it would get tricky as far as where I get placed then, because it would have to
Correct.
meet both requirements.
You would have to, yeah, you would have to work under both fields for 3 years.
Yeah.
And unless you worked both jobs 40 hours a week for 3, you know what I mean? You wouldn't finish by 2030.
Right. Or if the one job covered both areas, I guess that's what I was thinking, because if it was in substance
Yeah.
abuse and Medicaid, but
Yeah, so
okay.
what I would do is I would ask your case manager.
Okay,
And they will,
perfect.
yeah, they will help you work through it for sure.
Beautiful. Okay, great. Thank you.
You're welcome, Jackie. Any other questions? You can just shout them out, raise your hand.
So is this that email, is that where we fill the application out at?
Yeah, the email from the beginning, healthcareersnow.org/CPT. If you scroll down on the web page, you will see, I think it's a green button that says interest form. That's where you fill it out.
Okay, thank you.
And Micah, it looks like the information just got put in the chat about how you can contact the Syracuse region.
Thank you.
You got
Hi,
it.
can I ask a quick question?
Sure, Lucretia.
So for the May 2027, that's the time frame that we would need to graduate by. Realistically, is there like I guess a time frame? I'm just not familiar with the programs. Okay, I should be applying and accepted by this specific date in order to graduate by May 2027.
Yeah, it just depends on what the program is. If it's a 2-semester program, then you would have to apply by fall of 26. Or sorry, you'd have to start school by then. You just have to go through whichever program it is that you're interested in,
And
and
just
then
figure it out.
figure out how long it takes. Now, what I would say, Lucretia, is the best thing to do is to fill out an interest form with us, get a
Mm-hmm.
case manager, and they'll help you with it. They'll walk you
Okay,
through it. They'll talk to you about it. Like you could tell them what you're thinking, like what career path you're thinking about doing, and they'll be able
gotcha.
to help you see if there's anything still available.
Okay. And then one last question for BOCES. I seen the location on the prior screen. Do you know if that's also BOCES in like Buffalo as well? Like, is it all BOCES locations?
Yeah, we're contracted with a bunch of different BOCES locations. Onondaga, Niagara, or sorry, Ontario, Niagara, or BOCES we're contracted with. But on our websites is all the schools that we're contracted with. So
Okay. And off your top of your head, Erie as well? Like,
I know in Rochester, all right, Erie BOCES, yes. Kathy
okay.
Alonso, I
So like
think.
Cheektowaga.
Yeah, I'm not sure off the top of my head, Lucretia. I'm
Okay,
sorry.
that's no problem. I'll fill out the interest form. Thank you.
You got it.
Okay, this is Jackie again. So I had a question about, I missed the beginning of that. Was the question as far as locations that we can work at afterwards for the 3
Oh,
years is, no.
no,
Okay.
no. She was
Okay.
just asking about what schools would be available for that we're partnered with for schooling.
Okay, thank you.
You're welcome. Any other questions?
Yeah, hi.
What's up, Andy?
I was wondering if there's any discussion about the program being extended past this May
Great question.
27.
Yeah,
Just
great question.
because at this point, as others have mentioned, so many master's degree programs are now ineligible because of
Yeah.
because there's
Yeah,
no
no,
opportunity to do them part-time
yeah, no, it's a
in
great question.
particular, yeah.
Yeah, great question. Yeah, we do not know yet if we are going to be extended the funding again. But as soon as we know, of course, if we are extended the funding, it will be, it will be on our website and it will be out there and people will know. But that is a great question. We are not sure yet.
Is there like a newsletter or mailing list we can subscribe to get updates, or is it just check the website
Just checking the
periodically?
website,
Okay,
Andrew.
thank you.
Yeah, of course. You can always email me too, Andrew.
Okay, great, thanks.
You got it. Any other questions? Okay, I hope that this was helpful, everyone. I will actually stay on if anyone has any questions that they just weren't comfortable asking in front of the big group. I'll stay on until everybody's off. Nice to meet you all, and good luck.
Thank you so much.
You're very welcome.
Yeah,
I have
thank
a
you. This is really
question.
helpful.
Sure, Nicole.
So I currently work for the Buffalo Public School District as a registered nurse.
Cool.
The majority of students are uninsured or Medicaid students.
Okay.
Would that qualify as an employer to fulfill my 3 years of employment?
I don't know. But
Okay.
if you check when you get signed up with us, we
Okay.
actually have a partner email
Okay.
that the employer, the school, can send an email to, like with us, with It Flips, to see if they would qualify to be somewhere that you could work afterwards. I just
Gotcha.
don't know off
Okay.
the top of my head.
Okay. Thank you.
You're welcome, Nicole. And again, I'm here if anyone has any questions or.
I do have a question right before you leave.
Okay.
So I was just filling everything out as we were talking. I did fill out my FAFSA. I filled out for the program in like January, but I must have did something wrong because I never got a reply back. I went to my FAFSA and I
So
was
you
looking
fill
at
out,
it. Go ahead, I'm sorry.
you filled out the interest form with us and then didn't get a reply back?
I didn't. I think I did it through Duville. And
Yeah, you
I
have to,
asked them
you have to do it through
questions.
our website.
Okay. So that's probably why I did set up certain things. They put it in the chat though, so I did redo it. So hopefully, but it looks like I did it before. They'll call me.
No, yeah, that's interesting. If you want, you can email myself or Alanka. She put her information in the chat too. And we can just see if you already have an account with us and we'll let you know.
Actually, I'm gonna jump in. Shimon, I sent
Yes.
you a message, okay? It's in your
Okay.
email. I have sent you a private message as well.
Look at that.
Okay.
Perfect.
All right.
Thank you.
You're
Thank
welcome.
you, Keisha. Keisha's another rock star that works with us. All right. Any other questions?
Thank you all. Have a good day.
Looks like Lily. Oh, you too. Looks like Lily has a question, and maybe Jackie.
Hi there. Thank you so much for taking the time for us.
You're very welcome.
I think that someone may have asked a similar question in the chat, but I wasn't sure. But basically, I'm just wondering, are you able to, like, if we're accepted to the CPT program, are we able to accept like federal loan for like living expenses as well?
Yes.
Oh,
Yeah.
okay.
Yeah. But just be aware that if you
Mm-hmm.
get the funding,
Right.
it's going to go, you know what I mean? Our money is the last money in.
Yeah.
I do know that we've had some examples of students that get funding after we pay for their tuition. They get some other different kind of funding for their living expenses or for other things. and then they
Mhm.
don't get it until we pay their tuition.
Okay.
So if it's that kind of a situation, that may
Mm,
not work because you won't
yeah.
get it until you're 3 or 4 months in.
Right.
I'm just throwing it out there. Our money is the
Okay.
last money in, and so if you
Yeah.
do get any other kind of tuition assistance or any other kind of assistance, that may be
Mhm.
used first. Uh, but
Okay.
but the best thing to do is to talk to the finance office at the school, and
Okay.
they'll be able to help answer that. Unfortunately, a lot
Got
better
it.
than.
Okay.
Okay.
No, that makes sense.
Okay,
I'm
cool.
just trying to figure it out
It's a great
because my
question. Yeah.
yeah, no, I appreciate it. My current like FAFSA loan offer, it wasn't a scholarship, it was for like a loan of some kind.
Okay.
It's a little more than just my tuition to cover like room and board and stuff.
Okay.
So yeah, I'll talk to the office
Sounds good.
and maybe my case manager eventually. But thank you so
Okay.
much.
Cool. You're very welcome, Lauren. Jackie, another question?
Yeah, just one last question. I thank you, by the way, whoever sent me the email. I appreciate it. Following up with my interest letter. And it says, have I filled, so I have applied. I haven't heard back yet. You know, I'm starting this August. It says, have you filled out the FAFSA? But I'm assuming I can't fill out FAFSA until I've been accepted. Probably, is that
Accepted at the
correct?
school?
Yeah,
Oh, yeah.
maybe I can.
That's a great question. I don't know that answer. I don't know if Alanka knows that answer. I do know the case managers will tell you that you have to fill out your FAFSA and your TAP before you can put in the application with us. So, but I know that you're
Okay,
still waiting to be
okay.
accepted.
Okay, so I'll look into see if I can
Just
fill
ask the
out my
case manager that
FAFSA.
question. Yeah,
Okay,
ask
great.
the
Thank
case
you.
manager. You're
Okay,
welcome.
thanks for all your help. I appreciate it. Have a good
You're
day.
welcome, Jackie. You too. Sandy, do you have another question, or is that from before?
Uh, Another question. So, I think someone already kind of like I asked a question, someone also asked about room and board. I just got off the phone with my financial aid office in Fredonia and I explained the situation. So I just kind of I reached out to you as well through email. So whenever you have a chance to follow up, it's just not too long ago, about a couple of days ago, my vehicle just went kapooey and I was eligible for some unsubsidized loans. So I accepted them, but I then, asked the question and you informed me that those funds might be hit towards my, I believe my tuition first.
Tuition, yeah, I'm not sure on that. So I am definitely not the right person to ask about that. So you would have to ask the financial aid office at the school. I
And
would,
then
I do not know that. So
okay, and I could also coordinate with my advisor with the FLIPS program, right? My
absolutely,
counselors.
with your case manager. Yep, for sure.
Okay, I'm just so excited for this opportunity that I really don't want a
No,
vehicle being
I don't,
out to be
yeah,
a reason.
I don't
So
blame you. Yeah. Advocate for
but
yourself. Keep doing it.
thank you so much. But I do have to take a moment to let you know that your voice has been so welcoming and it's been
Okay.
very
Thank
easy
you.
to ask you for questions. And thank you so much for taking the time to educate us all. And thank you for the
Sandy,
program
I
giving us
appreciate that.
all
That was very
the
kind.
opportunity. Not to worry,
No,
I'm
thank
a
you.
I'm a
I appreciate
psychiatrist, medical scribe, so I do know that there's a big need. So I admire all of your team for all their hard work. So I look forward to this new opportunity and thank you so much for being so professional and welcoming.
Thank you. I appreciate it. Thank you very much. Any other questions?
I have one more question if we have a minute.
Of course, Nicole. Anything.
Is there a deadline for this upcoming fall semester or a deadline for
There
the
is.
spring of 26?
14 days before is the
14 days.
deadline. So
Got it.
14
Okay.
days
And that's
before the school start date, you have to
okay.
have your application finished with us. So if the school starts on August 25th, you have to have your application finished with us by August 11th.
Got it. Okay. Thanks so much.
You're welcome. Okay. I'm still going to hang out till the end. So if anyone has any questions that you're just too shy to ask in front of others, I completely get it.
Yeah, I have a question. I know that you're putting together a list of providers that will be available for the 3-year term after graduation, but wondering if Rochester Regional Health is one of those that you're aware of off the top of your head.
Oh, yeah, there are probably many Rochester Regional Health providers. But yes.
Thank you.
You're welcome.
I have a question, Mackenzie Neary.
Hi, Mackenzie.
I was just wondering if the Jewish Home of Henrietta is one of the eligible places to work.
Great question. I do not know, but if you send me an email, I can find out for you if we have them on board yet.
Okay, sounds good. I'm a CNA there, so.
Cool. All right. And quite honestly, Mackenzie, if they're not, you can have the leadership there reach out to us to get them on board if they serve 30% Medicaid and or uninsured.
Okay, sounds good. And I have one more question. So say I'm applying to the MCC LPN program and I do not get into that. Is the money only good once, or can you apply to another class if I want
Oh,
to
you
go
can,
somewhere
yeah.
else?
No. You're saying if you don't get into the program?
Correct. They
Yeah.
only take 32 people.
Yeah, for sure. So if you don't get into the program, you won't even be able to complete an application with us for it. So you have to have the acceptance letter that you're in the program to even complete an application with us.
And if
So
I do not get an acceptance letter for there,
yeah,
then
that
I
means
just
that you haven't even applied with us. So you can apply for anything else. Absolutely. Yep.
Okay, sounds good. Thank you very much for your time.
You're welcome. All right, everybody. I am going to be heading out. Does anyone have any last second questions? All right. It was nice to meet you all. If any of you need anything, you can reach out to me anytime. Have a great day, everybody.